A single vitamin deficiency can quietly disrupt your sleep.
You can be asleep for 12 hours a night and not feel refreshed. Vitamin D levels in the blood were related to our ability to get paralyzed correctly. That was a very unexpected discovery. We're not deciding to eat 8 bags of popcorn.
Gut can influence your dreams.
Lousy sleep is the new normal.
More sleep means better sleep.
We ended up having deficiency states that we didn't expect.
You can sleep for 8 hours and still wake up exhausted. You can spend half your life trying to fix your sleep, going to bed earlier, staying in bed longer, changing your routine, and still wake up at 3 a.m. wondering why your body won't let you stay asleep. But what if the problem isn't simply that you're not sleeping enough? What if your body is trying to tell you something? Because while you lying there in your sleep, eyes closed, your brain isn't really switched off, or is it? Your body is moving through an incredibly complex process, regulating chemistry, repairing itself, communicating with the gut, balancing the nervous system, and moving through stages of sleep that can affect everything from your memory and mood to how you feel when you wake up. And some of these pieces involved may be for more unexpected than you think. Daylight, vitamin D, your gut, your microbiome, the organisms living inside you, the chemistry of your brain, all connected to something we do every single night. And suddenly, the question isn't simple. How many hours did I sleep? It's whether your body actually got what it needed while you were asleep. Because if you can spend 10 hours in bed and still wake up feeling like you haven't slept at all, maybe the real mystery isn't why you can't sleep or have not had good quality sleep. Maybe it's what your body is trying to do while you're asleep. Welcome to another episode of Khan Clinics. I'm your host, Dr. Amir Khan. And today we're honored to have Dr. Stasha Gominak with us. Dr. Gominak is a neurologist. She's a sleep researcher. She's an educator and creator of the Right Sleep program. She currently is based in Tyler, Texas. During more than 3 decades of neurological practice, she treated patients suffering from headache, chronic pain, fatigue, and importantly, sleep disturbances and neurological disorders. Dr. Gominak has written numerous powerful articles on sleep, vitamin D, gut, microbiome to improve health. Her work led to the development of a Right Sleep program, which has sparked worldwide interest among patients and healthcare professionals, seeking better understanding the relationship between sleep, nutrition, and overall health. Dr. Gominak completed her neurology training at Mass U, teaching hospital at Harvard Medical School, and later joined the clinical assistant professor at Stanford University as well. Dr. Gominak, welcome to the show.
Thank you for inviting me, Amir.
So tell us about what are your current interests in sleep specifically, and what is Right Sleep program?
The Right Sleep program is a combination of vitamins that have turned out to be extremely important in producing one of the neurotransmitters that allows us to sleep normally. That combination is a little complicated, so I have a workbook that's called the Right Sleep Workbook that tells you exactly what to do and when. And the intention is not only to give back the raw materials that are missing that have led to sleeplessness and, in my belief system anyway, sleep apnea as well. But it's also changes in the recommendations regarding habit. So most of the CBTI, or cognitive behavioral therapy for insomnia, has suggestions that may work for many people but haven't worked for my clients. And that means the group that I end up seeing, I believe, have a chemical deficiency state that leads to a lack of acetylcholine, which is a neurotransmitter, and to specific sleep problems, but also accompanying issues in health that have a lot to do with the autonomic nervous system.
Sure, sure. So the Right Sleep program is a program that is specifically for insomnics, or would you explain to our audience what does insomnia mean, and what is a CBT program, for example?
Okay, cognitive behavioral therapy is suggestions that are given to change one's behavior, and that is the major treatment protocol that's recommended to all the sleep physicians. And it includes things such as going to bed at the same time, waking up at the same time, blackout curtains, keeping the room cool, and not doing anything else when you're in bed. And all those things might be good advice, but for the people who have sought me out after they've tried that, those interventions haven't helped. What insomnia is inability to sleep. And the great majority of the people who look for help are people who fall asleep easily and sleep until about 3 a.m. And then they wake up and they either can't go back to sleep again, or they feel that they sleep more lightly and they feel unrested. And sleep apnea is stopping sleeping due to collapse of the airway. So I believe that all people with sleep apnea, whether it's obstructive or central, need to address the chemical deficiencies as well as their anatomic assistance through sleep dentistry, or what you do, either with CPAP or other interventions.
Brilliant. Thank you for explaining that. So it seems like, Dr. Gominak, that you've sort of established a relationship between sleep and associated diet deficiencies. Explain our audience what's the link between the two?
Let me just add that you said nutrition and diet. And in this particular case, these deficiencies developed without any nutritional or dietary changes. And that is something that is extremely important, and it's a really hard way to change one's beliefs that something that's called a vitamin, which is vitamin D, is actually about a habit, not nutrition or diet. So one of the shocking things that happened to me and my patients was to fall into the unexpected result that vitamin D levels in the blood were related to our ability to get paralyzed correctly and the timing of our sleep, our attachment to the clock, the 24-hour clock. Finding that vitamin D was related to that, finding that all of my patients who I did sleep studies on, who had abnormal sleep studies, had low vitamin D, and that all of the sections of the brain stem, the part that we call the reticular formation, or the reticular activating system, which is a part at the very base of the brain where it becomes the spinal cord, a little tiny area. It's about this big around. And that runs our level of consciousness and our ability to sleep and our ability to transition through the phases of sleep. And the cells that are sitting in that part of the brain have vitamin D receptors. So that means that something that you do, like not go outside and protect your skin from the sun and become educated and take an inside job, can actually advance you in the socioeconomic status, but make you deficient in a chemical that is actually a hormone, not a vitamin, that runs your sleep. That was a very unexpected discovery, and it changes our view of what is a vitamin, what is a deficiency.
Fascinating. Normally, vitamin D's deficiency you mentioned is related to not going out in the sun. So are we saying that if we're not going out, we don't have that, we have that deficiency, it could affect our sleep?
Absolutely. And there's a basic belief system in the background, which is partially related to an evolutionary viewpoint. You have to look through a lens that says, gee, we have the same physiology or the same function as all the other animals that live outside, and they stay outside all day. They can't actually get food by staying in their little hidey hole that they sleep in. They have to go outside and be in the sun. Humans have done exactly the same for 300,000 years, or hominids at least, walking upright, looking very much like us. That means when we decided that we were going to protect ourselves from the sun with sunscreen, and then came a change in our habit, which was most of us now go indoors for our work. We don't dig in the dirt and plant things any longer. That means if you look at the statistics on how much time we spend outside, it is much, much lower than it was 100 years ago or 200 years ago. And it is also established greatly by where your position is in the socioeconomic makeup of your country or your world. Are you still farming in the dirt? Do you then move into an air-conditioned tractor? Because one of the things I realized was if you stay as a rural person who's a farmer in the United States, you still don't get a lot of sun exposure because you're in an air-conditioned tractor. You're moving big machines instead of actually going out and digging in the dirt. So that means that we are actually connected to the energies that are given to our planet from the sun, and that was always our biology. And when we moved indoors, we ended up having deficiency states that we didn't expect.
Fascinating. You mentioned, Dr. Gominak, that vitamins are very important. And you mentioned vitamin D. We're going to come to that in a second. But you also you just mentioned about how the muscles get paralyzed. Is there any part specifically in sleep that our muscles get paralyzed when we sleep, or are they paralyzed throughout the sleep?
That's an excellent question. Thank you for asking that, Amir. There's some debate about this. Uh, the one thing we know for sure, based on experimental results, is that in rapid eye movement sleep, which is a phase of sleep where we can measure that the eyes are moving back and forth in a regular pattern. And that phase of sleep is particularly important. It usually happens between 3 a.m. and whenever you get up. And the fact that people say that they wake up at 3 a.m. and can't go back to sleep, those people usually have several other complaints. They feel tired in the morning, they often have a bad mood, they can't remember very well. So even though we don't exactly know what these phases of sleep are doing, there are certain clinical complaints or symptoms that occur. Then there were two phases. One of them was slow wave sleep because the little waves that the brain generates are slow and big. And when they would try to wake someone up from that phase, they would usually be a little confused and kind of out of it. Then in REM sleep, if you woke someone, they would usually tell you they were dreaming. Now those are all very generalized comments, but in a general sense, we can say that we have light sleep and deep sleep. And it is my belief that we actually get paralyzed during slow wave sleep. There's been less reported about that, but I believe that we get muscular paralysis during deep sleep in order to repair the moving parts. And then we have good documentation that during REM sleep, we become very paralyzed.
And is there any specific type of vitamin D deficiency that our audience need to be aware of? And is it just vitamin D that is we need to be worried about, or are there other vitamins? And what can we do to prevent this?
Thank you, Amir. That's a beautiful question. Leads us right into the next part, which is when you become D deficient because you're trying to do what everybody told you to do, which was to get an education, show up for your work, put on sunscreen on yourself and your kids. You have a vitamin D deficiency that goes low enough that the amount of D that you're making on your skin is not enough to sustain what is called a normal human microbiome. That word microbiome means a group of small microbes that are living in your intestine. And it's different at each part. It's different in your mouth than it is in your throat, and in your stomach, and your small intestine, and then in your large intestine. And it's made up of bacteria and viruses and fungus, and they're all supposed to be there as an organ of your body. This is a relatively new way to look at bacteria, but in the last 15 years, it's become very clear that if you do not have a normal human microbiome, you will have multiple medical issues that are actually related to things that that microbiome was supposed to be contributing to you as a whole human. So people who don't have a normal microbiome are not really functioning at their peak performance because they are missing multiple things that could be called vitamins. So in the background, D deficiency comes with a microbiome that is not normal. And it turns out that the microbiome makes several things that are pivotal for sleep. So 8 of those things that bacteria make have been called the B vitamins. If you've never thought about this before, and it took me several years before I clued into it, the vitamins are called A, which is one single thing. Then there are 8 things called B, and then there's C, which is a single thing, and D is a single thing, which is not really a vitamin. And then you'll find that it was actually a yeast bacterial mixture that the early microbiologists, the people who studied bacteria, were using to grow bacteria. And it turns out that there were bacteria and yeast together because yeast gives them D, and the bacteria make all these chemicals that make the yeast happy. So it's a kind of a cohabitation environment, much like our body. So we're here, we think we're an individual, independent, having all our own thoughts, but it turns out that there are all these bacteria living inside us, and it turns out they make chemicals that make us hungry for very specific things. And they also affect what happens to the calories we eat. And it turns out that we're not deciding to eat 8 bags of popcorn. There are actually microbes that are secreting chemicals that go up in your nose and make certain things smell good to you. So those donuts that you know you shouldn't eat, they smell so good. And those chemical messages would have made you survive in the past, but now they're making you gain weight. So there are these unusual things that we've shown over the last 10 years, and they absolutely are playing a role in your sleep. And at least 3 of those B vitamins are pivotal to have normal sleep. B1, which is thiamine, B5, which is the one that I've been talking about that has been relatively overlooked since the 1960s, and B12 are all heavily involved in sleep, and they probably all come together to contribute in this making of the chemical that I referred to before, which is called acetylcholine. So it's an electrical environment. We're sending messages and we're telling the brain what to do, and your body is responding to it. But it's all done through chemistry. And that means when we went indoors, we lost D and we lost the bugs, the bacteria that are making these chemicals that come together to make one of the chemicals that paralyzes us normally, and also has a contribution to the clock that allows us to sleep at the normal hours between 10 p.m. and 6 a.m.
Dr. Gominak, thank you for explaining that. A thorough answer. Dr. Gominak, next section is about some of the myths or facts, and we want you to just give your opinion on it, just a one-liner answer so we can go through some facts and myths. The first one, sleep can change your personality.
Absolutely true.
Brain can still be exhausted after 8 hours of sleep.
Absolutely true.
Tell us how, briefly.
One of the most important experiences I had was doing a sleep study in an 18-year-old girl who came to see me for daily headache. She had a sleep study that showed that she never got into any of the deep sleep phases. She actually woke to light sleep. She was asleep. As far as she was concerned, her sleep was normal. She would go to sleep. She knew that she had to try to sleep longer than other people, but her sleep study showed that she would awaken to light sleep 35 times an hour, because what we saw was a change in the phase of sleep, because every time she would try to get to deep sleep, she would wake up. That means you can be asleep for 12 hours a night and not feel refreshed and have really severe abnormalities on a sleep study that I believe can be either anatomic or from this chemistry we've been talking about.
A single
Absolutely.
vitamin deficiency can quietly disrupt your sleep. Myth or a fact?
Yes.
Okay. Myth or fact, your gut can influence your dreams.
Absolutely true.
Dr. Gominak, your final message to our audience.
I would invite you, if any of these things resonate for you or your children or your relatives, to come to my website, which is drgominak.com. Go to my YouTube channel, which is Dr. Stasha Gominak. Watch more interviews, and then come to my website and become a Right Sleep member and do the Right Sleep program to improve your sleep. And don't forget that there's always an anatomic examination of your throat, as well as, so I usually want you to have a clinician who's a sleep clinician and to be doing Right Sleep. So we change the chemistry, and you have somebody who's your treating physician at the same time.
Dr. Gominak, thank you for joining us today and sharing your insights on one of the most important yet overlooked aspects of health. Thank you for coming to the show.
Thank you so much for asking me.
To our viewers, if you enjoyed this conversation, subscribe to Klinics. Click the bell icon so you never miss an episode. Share this discussion with someone who constantly feels tired despite getting enough sleep. It might change the way they think about health. This is Dr. Amir Khan signing out. Stay informed and stay empowered. Thank you.